So a very good evening to all the residents and all our panelists attending the DREAMS Radiology Resident Orientation session tonight. On behalf of DREAMS, I, Dr. Natasha Gupta, extend a very warm welcome to all of you. So today's session has been specially planned and designed to address some of the important queries that trouble the minds of the young radiology residents. And we hope that this session will help to provide some useful guidance to you and give you some correct directions and insights. Now, first and foremost, I would like to introduce to you all Dr. Amit Punkar, who is the course director of DREAM. And he is a person who actually works in the shadows. We do not see him often, but he is actually the person who is the backbone of DREAMS. And he is the one who has kept DREAMS sailing for the last 3 years. I now take the privilege of introducing to all of you none other than Dr. Lalendra Preti. Sir is the Chief Academic Coordinator and the mentor of DREAMS. Sir needs no formal introduction as such. He is an extremely popular teacher, a passionate academician, and he is very widely known among all the circles of radiology residents. Sir has been the chairman of the Indian College of Radiology and Imaging, HOD Radiology at UCMS Delhi and Rajiv Gandhi Super Speciality Hospital Delhi. He is a pioneer in resident education, has also worked as the national coordinator for the resident education program of the IRIA for several years. He has been an examiner for DNB and MD students for more than 20 years and also an examiner for the fellowship exit examination of the ICRI. Now, among our other panelists for today, we have some very special invitees, and these are some young and dynamic radiology consultants, fellows, and senior residents of radiology who have gained specialized experiences and expertise in different aspects and spheres of radiology. And they were themselves postgraduate students not very long back, and they are here today to share with us their own experiences and give you all some tips and knowledge that they have obtained during and after their post-graduation in radiology. So we have with us as panelists today Dr. Ayush Agarwal. He did his MD in radio diagnosis from UCMS New Delhi, followed by senior residency from MAMC New Delhi. He is a fellow of the Royal College of Radiologists, that is FRCR, and he has also done fellowship in MSK Imaging, and he is an FRCR faculty at the Study Medic Academy Private Limited, Kerala. We have Dr. Siddhi Chawla, who is currently assistant professor at Sardar Patel Medical College, Bikaner. She has done a fellowship in pediatric radiology from AIIMS Jodhpur, and her areas of special interest include pediatric imaging, abdominal imaging, emergency radiology, and neuroradiology. Dr. Anindita Bose is MD from UCMS Delhi. She has done a fellowship in breast imaging from HCG Hospital, Bangalore, and she is also the global ambassador for breast imaging education and diagnostics. Dr. Ujjwal Agarwal has done his MD from Tata Memorial Hospital, followed by senior residency from the same hospital, and currently he is a fellow in interventional radiology at Sir Gangaram Hospital at New Delhi. Dr. Lavanya Y is senior resident presently at the ESI Corporation Medical College and Hospital, Chennai, and she has done an ICRI fellowship in diagnostic neuroradiology from Apollo Hospitals, Chennai. Dr. Batul Fatima is DNB radio diagnosis from Sikkim Manipal Hospital of Medical Sciences. And we have finally Dr. Tulika Kamboj, who has done her DNB from Sri Balaji Action Medical Institute, New Delhi, and is presently a senior resident at UCMS, New Delhi. So a warm welcome to all of you, and thanks for your precious time for consenting to be here to help the residents tonight. Okay. So now we have compiled a series of questions with inputs from the residents of the 3 years, from the first year, second year, third years that we have come across with. And I will be putting each question one by one to our panelists. So let them answer first. Just just follow all the questions. You might ask few related things. You might write in the chat box if there are few related queries to the questions that are being put up. And after we are done with the questions, then if there is anything left, if you have still more doubts, some more queries, you can put them in the chat box and we will discuss each of them one by one. So a very basic question that comes to the mind of a first year very frequently, that was joining radiology for post graduation, was it a wise decision or a mistake? I would like to put this to you, Dr. Preti, sir.
Thank you very much, ma'am, and good evening to all of you from my side. Yes, this is a question people ask before joining. Should I join radiology? And after they join radiology, initially, because radiology is an entirely new discipline for a person who has done his MBBS and internship. You just are sitting in a room looking at X-rays, and you have not reported actually anything during your internship. So sometimes you have this doubt. I also had this doubt because I could not understand. I could see senior residents and my senior PGs, writing reports quickly. I'm not able to understand anything. So this kind of thing happens for initial 2 or 3 months. I think most of you who are here as panelists must be having this feeling. But let me tell you that radiology grows on you. So as you study, as you look at the images, you start understanding the images, you start interpreting the images, and gradually, after 6 months, I can assure you, you will never regret the decision for joining radiology. Radiology has many plus points. Another reason which has recently come up is this AI. People are very apprehensive that now artificial intelligence has come. Is it going to replace radiologists? So that thing I can tell you, artificial intelligence is not going to replace radiologists, but it is going to be a very useful tool which will work with radiologists. So if you can take maximum leverage from the artificial intelligence tool, your reporting will become good, your case flow management will become good, and so I just want to assure you that you need not have any apprehension about joining radiology. Just go through the routine, learn from your seniors, you will start enjoying it. And when you pass out your PG and you are, 2-3 years into the practice, either as a consultant in private or in government sector, you will realize that you are doing much better than your other colleagues.
Well said, sir. Another very common query that comes to the minds when we join an institute, a college, is that how do I learn and master the imaging modalities and specialities that are lacking in my own institute? So it is very frequent that some college may not have MR, another one will not have too many interventions, DSA, most of them will not have PET. So this is a very frequent doubt that comes to our mind, that how will we do the exam without this particular modality, and how are we ever going to learn it and master it? So Dr. Lavanya, would you like to share something from your experiences on this?
Yeah, hello, good evening, everyone. So yeah, I think radiology is very vast. So it's not possible for one institute to have complete competencies in all across all modalities or across all subspecialties, right? So the first thing is just look at the positives. Look at what your institute has to offer, and if you can do very well in that, then don't worry, you have a lot of opportunities in life to build on what you've not received, right? So, for example, I
Just
work
a
with,
moment, sorry to interrupt.
yeah,
Dr. Lavanya, is it possible to switch on your video?
yeah. I'm so sorry. All right.
And I would request the others to kindly switch off their audio for the moment, because I hear some echo.
Yeah, some
And
cross.
then we can just switch on our audio when we are put a query, right? So please go on. Yes, Dr. Lavanya, we can see your video now.
Yeah. So, like I was saying, just focus on what your institute has. Like, for example, where I did PG from, I didn't have MRs. And also I was in the COVID batch. So even if I had an opportunity to go outside to another institute for MR, I didn't have that because 1 year went in COVID, right? So, but fortunately, I joined another institute after I finished my PG, and there that I had a brilliant MR exposure. What I had instead was very good antenatal exposure because my college was very good at doing antenatal imaging. And this was not an opportunity which was there in other hospitals in South. So I'm saying just take life as it comes your way and focus on what you have and make the positives out of that. And after that, it's a long learning curve. You still have 2, 3 years after finishing radiology to pick on all these things and improvise overall. You can always talk to your friends, attend courses, try having good connections with other areas or other doctors to try and work during PG period on the areas that you don't have very good exposure on. And that should be fine.
Absolutely. So build upon your strengths and you will soon overcome all the weaknesses.
Yeah.
Sir, would you like to add something to this, Supreti sir?
Yeah. So right, as Dr. Lavanya said that you can learn these modalities after your PG. I would just add to that that you can even learn while you are doing your PG. See, most of you would be joining in a hospital, which is a medical college, and because of some reason that might be lacking in other modalities. But let me tell you, most of your patients, supposing you do not have MRI, right? So most of your patient would be going outside for MRI, right? And they would be bringing MRI to their clinician. So you need to be vigilant about that. If you're keen on learning, like when I was doing my PG, we didn't have CT. We were just doing the ultrasound. But CT was there in the private sector. It takes time. Private sector is the first to take the initiative. So what we used to do, we used to go to wards. Actually, this is what we actually used to do. We used to go to the wards, talk to our fellow senior residents, and then collect their CT scan. And then we used to see those images and then try and learn from them. So that is how we formed the basic idea. So in order to, be competent enough to answer questions related to that in our examination. So if you don't have MRI, just be in touch with your colleagues from other specialty. As and when you get an MRI, just tell them, request them to have MRI, send MRI to you, or you go to them and get the MRI, read that with your senior resident, and gradually you will get some degree of competency. And as Lavanya said, that post PG, the whole world is yours. You can do anything, and learning is a lifelong process. I learned CT during my senior residency. I didn't have MR when I was a senior resident. So when I became consultant, I learned MR also. While in fact, I learned MR when I was professor. Till that time, I didn't have exposure to MR. So there is no lack of opportunity. Opportunity is everywhere. The thing is, this opportunity is not going to come to you. You will have to make efforts to go there. So that kind of thing, you have to have that kind of initiative. Even in your PG, you will be able to learn a lot, at least sufficient enough for appearing in your examination.
Right. Now, another very important question is that actually the residents need guidance here is how to study radiology and how to divide the study in the 3 years of residency. So I would again like to put this to people who have recently passed out. First of all, Dr. Lavanya, again to you, how would you advise the residents should divide the radiology studies during the 3 years of residency?
Yeah. So I think depending on where you work, most of you would be having very hectic duties. Okay. So if you're going to look at it in a very overview, if I have to give, you might get maybe 2 to 3 hours at the max a day, or somewhere even less than one hour or something. So the thing with
Your
radiology
video,
is,
please, if possible, kindly switch on your
yeah,
video.
okay, yeah, okay. Yeah. So I would say there are lots of options, but mostly people don't know where to start and what to be focusing on. Um, in my personal experience, to be a good radiologist, you need to have a balance of both your detail as well as knowledge. The first 2 years, I would recommend you to sticking to building your knowledge, right? That can be through RSNA articles, which is like a very good resource for building that helps in your day-to-day practice, as well as what you might eventually be asked in exams as well, and attend a lot of online courses. When I say lot, not a lot, stick to one or two, whatever you feel comfortable with. Like I had, I think the Dreams program, yeah, I enrolled in that towards the end of it. It started towards the end of my course. That's a very good area. And the other is ICRI teaching videos. So have one or two online lectures that you're comfortable with. And first 2 years, focus on building the knowledge through articles. My first suggestion would be to go through a lot of articles. Third year, you have to be a little bit more exam oriented. And by the time you come to third year, because you have already been reading articles, there's also a suggestion, there's RSNA blueprints. So blueprints gives you like the top 10 to 12 articles which are needed under each subspecialty from a resident perspective, and also what's likely to help you in your day-to-day reporting. So if you cover that in your first 2 years, you would have already done like say 50 to 60% of your radiology syllabus on a gross level. So the third year, you can focus on orienting yourself with textbooks. My personal suggestion, because I used it, was the AIMS MAMC PGI series. That was quite holistic with a good balance between detail and knowledge. And I think there's also an IRA textbook which has come out like a few months ago. I'm not very sure because I have not used those textbooks, but you can try giving that a look as well. If you go through these two things, I think you would be fairly, and if you're DNB residents, I think there are various sources like you have DNB notes, these kind of things. Yes, you need to also refer to that because you have to be a little bit more up to date. My top suggestion is whatever you've studied from, stick to that. Don't keep changing resources. And this whole attending online lectures and classes, start doing it from day one, make your notes and go back to that. Don't try to read the same topic from multiple sources unless you really have to prepare for a seminar or a presentation. I think that would be a good approach to covering radiology.
Thanks for the very useful tips, Dr. Lavanya. Dr. Batul, you are also a recently passed out resident. So would you like to express your experiences and opinions on this?
Hello, good evening, everyone. Yes, so first and foremost, I would like to say, as a DNB candidate, to begin with, initial days, I think the exposure is less on X-rays. So when I was giving my X-ray, was about to give my practicals. So one has to one has to get all the thorough knowledge of X-rays, because that is a time mainly DNB examiners focus on conventional studies, and we usually lack those things. So start with X-rays or barium first of all in the first year, because eventually in the practical time, that is the first scan that will be given to you, and maximum time it happens that your whole viva is in that particular film only. So my first advice that please read chest X-ray survival guide and Felsen, not line to line, but yeah, at least have an overview and be like little familiar with the science and X-rays and everything. Secondly, carry an anatomy e-app with you. In my exams, I was asked about anatomy. So like they'll point it out in a structure and they'll ask you this thing. So do carry Weir or e-anatomy app and refer. As much time as you can devote to anatomy, it will be better for you. So during these 2 years, you can just have a random reading on every topic possible. Like ma'am said, you can have RSNA reading. You can have main, like suppose a case is there, you can just go and read everything about it from Haga or any standard textbook. You need not to read Yokam from line to line or everything, but yeah, pictorial memory will help you a lot. Apart from that, as you approach third year, especially in DNB, you have to make sure that you do all the 10 years last year's paper, especially 10 years. You may not get direct question, but yeah, the topics that are covered usually remain same. So do not skip nuclear medicine because that is something very important. In the recent advances paper, like the fourth paper, usually people tend to skip nuclear medicine part, but no, that carries a huge syllabus, and you'll definitely get 2 questions from that every year. Apart from that, recent advances. When it comes to recent advances, you have to actually read DNB notes. There's lot to read, but try to make like 5 lines about particular every topic, and that will get you through. Because if you don't know the basics, suppose if there is any quick question, you just need to know any 5 lines, because in DNB you have very less time to answer a question. So like final year, you have to just go through all the papers and read MAMC Berry series or DNB notes. And for any like you have to enroll any in courses like I did DREAMS, and you can do any other courses like ICRI is a good option, you can do that. So final year should be focused on passing theory, MAMC series, notes, and enrollment of at least 2 courses. Do that, and I think you'll pass the exam easily.
Thank you so much, Dr. Batul. That was really very useful, I should say, very important points that you have conveyed. So there was a little relevant question here by Dr. Ronak. How to get e-anatomy for free? I don't know whether it's ethical even to take this question on this platform. Dr. Siddhi Chawla has already answered it. She has answered it that e-anatomy is not free now on current Android or Apple devices. The old versions of Android had e-anatomy for free. So, Dr. Batul, would you like to add anything to this query?
Yes, ma'am. In our days, it was free, but we are in Abraham, or even just you can carry that we are in Abraham soft copy in your phones. That will also do. It's not necessary that you have to stick to any particular app for that.
Okay. Another query that is relevant here. I am not taking up all the questions as they are coming in the sequence because many of the questions we are going to address in the later part of our session. So we'll come back to the questions, but whichever are relevant to the discussion, as of now, I am just picking them up. So Dr. Veera has asked where to get the DNB notes. So just let me tell you that DREAMS is also very soon going to launch some resident notes. But yes, what is your take on this, Dr. Batul? Where to get the DNB notes?
Like there are a lot many sources you can contact, but apart from that, if you're reading for a particular, suppose Berry series or anything, you can just have your own notes, like Osborne tables. You can just read those tables. DNB will not provide you a lot of time to write big answers, just point to point. Like a question is split into multiple subparts, like it's a question of 10 marks, it will ask you 2 2 2, so you have to be very precise. So you need not to have very lengthy notes. It's just point to point. So you can make your own notes, or you can even refer Radiopedia also at times when you feel like you don't have a proper answer for a question.
Okay, thank you so much. Dr. Tulika, you are also a very recently passed out, recently DNB cleared resident. So we would like you to share your opinions on this as to your approach for the years of residency.
Thank you so much, ma'am. Hello to all the attendees over here. Dr. Lavanya and Dr. Batul has very well told you guys about everything regarding the division of the syllabus in first year, second year, third year. I would just like to add a few things to it. For example, in first year, what we used to do is we used to see many ultrasound cases and X-ray cases. We used to go back and read it from RUMAC. Like if you read just like suppose you are seeing a case of liver abscess, you go and read it from RUMAC, and you also see the DDs of that pathology and read about the same how to rule out the DDs and everything regarding that in that day only. Like, and by the end of first year, you will see that you have covered a lot of topics regarding ultrasound query or X-rays also. And regarding physics part, yes, X-ray physics, ultrasound physics, we have to study in first year. There are books for that, like FAST or this Christopher for the X-ray part. And there is this book, MRI Made Easy, for MRI physics part, which is very good book, and it's a very small book also. You can complete it in like a week or 2 weeks for that, and this will clear up all your concepts regarding the MRI. And also regarding cases, we have many standard textbooks like Granger and Sutton. We can go and read small topics in like small parts. We don't have to read every book from first line to last line. We just have to collect every significant information of every particular topic, like whatever we see in the routine basis and in the first 2 years. And yes, as Dr. Batul rightly said, we have like in DNB, we are recently past DNB. There is a long list of 10 years question. We have twice yearly exams in DNB, and that makes up a lot of questions. We have to be very clear about in what direction we have to study. Like first of all, we have to see which questions are frequently asked. I made my own notes for that, like where I used to divide my all the syllabus, like okay, in neuroradiology these questions are frequently asked, these are less asked. You can prioritize that, and then you can study according to that. And talking about the query of the practicals, There are so many things regarding practical. Like what I did was we have RAD cases. Like I used to study RAD cases, and the DREAMS classes were really helpful in for preparing for the practical exam. Like there are long discussion cases, there are short cases also, and there is OSCE part also. These are really good, and there is a site which is a paid site. It was Radio Gyan. I paid for the subscription of that site, in which they had, like, now they have 200 OSCEs for that. I used to practice it, and I used to bookmark the OSCE which I didn't correct in the first time, and then I revised it after some days. Like, okay, this was the thing I did not correct in the first go. Then I used to revise it after some days. You can bookmark those questions on your iPad or wherever source you are studying. And we have plenty of resources for practical also. Like we have to revise notes also, because the OSCE part of the DNB exam is tough, and you will get the diagnosis sometimes, like looking at the picture, but the questions will be more theoretical. So you have to revise part of your theory also for that, and we require a lot of practice for that, spotters and OSCE part. Yes, ma'am.
Thank you so much, Dr. Tulika. So I see that Dr. Siddhi is simultaneously providing very useful answers in the chat box. Dr. Siddhi, I would just request you to change your answer setting to everyone. Currently, it is to host and panelists, so I think the other attendees will not be able to see the answers. So kindly just copy and paste these answers once again and change the settings to everyone, so that all the resident attendees are also able to see the useful information that you are providing in the chat. Meanwhile, I'll go on to the next point. Okay.
Ma'am, just few points I have to add.
Yes, sir, please.
So see, one thing everyone has to realize, that anatomy is the foundation of radiology, right? If you know the normal radiological anatomy, you will be able to spot the pathology very quickly. So you need to give anatomy actually a good amount of time in your first year. That is very important. Be it X-ray anatomy, be it barium, IVP, any modality, you need to learn that anatomy very well. Number one, I think initial 6 months or 8 months you can devote to anatomy, be proficient, read the physics also, and that is something I really wanted to emphasize. And I think you have some more question about exam in the later part of the discussion, so I'll just put it there.
Right, sir. Thank you. Okay, so coming to reading resources, so as some of the panelists have already said that there are several reading resources, there are websites, textbooks and journals. So we have actually compiled some reading resources to you on the basis of the inputs from multiple people, residents from MD, DNB fellows, who have passed out, and the various resources that they have consulted. So I'm not going to read through all this, but we have compiled them all, and we will mail this to each of you in person who is attending the session. We'll be able to get your email IDs, and we will mail this entire list of reading resources to all of you. Okay. Then coming to the next query, which radiology societies should I join during my residency? So, sir, we would like to address this query to you, this question.
So there is Indian Radiology and Imaging Association, IRIA. All of you must become member of that association. It's an Indian association. Currently, it has 20,000 members, and it is in fact one of the biggest body of radiologists in the world. So if you join this, you get concession for every event of the society. Some of these are free, some of these are discounted for the members. And let me tell you right now, IRIA and its college, Indian College, is doing a lot of teaching activity for the students and also for the practicing radiologists. So do become a member as soon as possible. Another thing is RSNA you should join, that is the Radiology Society of North America. The good news is the membership is free for the residents. While you are doing residency, it is free. Only thing is your HOD has to verify that you are a resident, and then you can become a member. And this gives you access to one very important journal, that is radiographics. And graphics has very lucid, well explained, detailed article for building concepts and for building knowledge, and also lot of help you will get in your exam and your reporting. So do also become a member of RSNA, and beyond that, it depends upon over a period of time. If you get interested in a particular subspecialty, we have society dealing with particular subspecialty, like we have gastrointestinal society, we have chest society, cardiac society, that you can join. But these two societies are absolutely must.
Yes, sir. Then regarding the radiology conferences, which conferences are the ones which a resident should preferentially attend, when to attend, and how to make the most out of them? So, Dr. Lavanya, I would like you to help out on this point.
Yeah. Okay. Right. So I think one good thing about radiology in India, like in most other countries, we do have a lot of CMEs, conferences being conducted at national and state level. So many of these conferences are also for radiologists who are actively practicing, which means they're at consultant level, right? So look out. So those are not going to be very helpful for you when you're in PG. So I would say look out for conferences which are primarily aimed at residents. So there's something called IREP, Resident Education Program, that you would be start going into Telegram channels. I would put it in the link if you are not aware, but all these groups are there where they keep posting which conferences are coming. So focus on the conferences which are aimed at residents. The one which I found useful was IREP. IREP also has, I think, a one-time on-site kind of event which happens once a year, and then there are also online CMEs or conferences kind of things which keep happening throughout. So that's the first suggestion. And the second is, more than conference, you should be focusing on teaching programs, or like the ICRI teaching program or DREAMS, or these kind of things is more important. I mean, if you really have time or dedicated interest, you can go for conferences which are focused only on a particular modality like ultrasound or MRI. But in my personal humble opinion, I think those are not needed for residents. If you do have the opportunity to attend one of them, that's okay. One or two you can attend, but make sure you're attending these resident oriented conferences first. Yeah, that's what I would suggest.
Thank you, Lavanya. Dr. Batul, would you share your opinions on which conferences would be useful for the residents to attend?
Particularly, just like ma'am said, it's more important to attend resident education program over any conferences in your PG days. Supposedly, definitely you have to attend one or two conferences like of particular interest. But if you have your exam coming up and you are I would suggest if you're a DNB candidate or an MD candidate, before your practical exams, do attend one mock exam. Like DREAMS is coming up with a mock test, so it's on site. So that will give you confidence to answer questions in your examination. So education programs in terms of ICRI, every Saturday, Sunday, they conduct good education programs dealing with all the modalities, and they're focusing particularly section wise, particular supposedly once a week they'll do all Euro thing and everything. So that's a very good way to learn. Secondly, if you are exam going and your practical exams are near, so choose a one mock exam which you have to give on site, so that on the day of exam you are little confident. Like many institutes do not have that IR exposure, so go to such conferences, just see, and that will give you another level of confidence that okay, you have seen all those things by your own. So the day of examination you will just have that basic idea that how things are going to be. So if you have any exam, if you're exam going, just don't attend any conference, just go to such mock session one or two, try to do that for maximum benefits. So I think a DREAMS is having a good mock exam, so you can attend one. That's all.
Thank you so much, Dr. Batul. I would also like to add as the answers for this particular query. So, as everybody has already mentioned, two of our panelists, the IREA is doing the IREA Resident Education Program. So, there are two on-site programs which happen in different cities twice a year. And other than that, almost monthly, we have online IREP sessions. So these are totally resident oriented. Other than that, look out for the mock exams, all the mock exams that you can get your hands on. And in many of the conferences, we have spotter sessions that are dedicated for the residents and the film reading sessions, the discussion sessions. So look out for these sessions. These are the ones which are resident oriented and which would really help you in the exam. Dr. Tulika, would you like to add anything on this point regarding the conferences, the CMEs to attend?
Yes, ma'am. I would like to say that in DNB, where there are only two residents, like most of the hospital have either two or one resident. Like I would say, it gets a little difficult for the students to attend the conferences, but the students need not panic in that sense. There is one annual conference of IREA held, the big conference where student can attend that, and I don't think any faculty would discourage for that. That is a very good event. And regarding the mock exams, as you also said, ma'am, and Dr. Batul also said, there are many platforms where the mock exams are held. One also at IREA in-house in Raleigh Road, ma'am, that IREA house, that they also have some mock exams, like after some months you can attend that. They are really good. They boost up the confidence, and more than that, we learn a lot by attending these mock exams, which we sometimes tend to skip in our routine, like day to day case discussions and all. And film reading is very important because we get a habit of using the console all the time, and when we get the film in the main exam, we feel very intimidated and we feel very scared before the exam. So I think film reading sessions are very important. We have to get used to the film reading sessions many times before the exam.
Thank you so much, Dr. Tulika. So, sir, would you like to summarize and close this point?
Yes, so few more points I want to emphasize. You need, when you are attending these conferences, even the CMEs, they have film reading session for the residents, and you need to be there in the session, giving the answers to the question. Like for example, this session is going on, and in the last you have this film reading session. Be there as a presenter. That is most helpful actually. And you should not be afraid that I am not able to pick up the finding. I am not able to describe the finding. At first, there'll be a problem. You will have problem in picking the finding. You will have problem in describing. But as you appear more and more into these things, as you appear more and more into these reading sessions and in the mock exam, your confidence will grow. So I have seen, people who are doing as a single candidate from DNB Institute. There are multiple students, but they were very courageous. They started attending these sessions, the film reading session, mock exam session, and by the time they reached their examination, they were speaking very fluently. So just let go of that fear, right? That is very, very important. Be there in person, be on the hot seat, and you will see yourself change in within 2, 3 months. Because in exam, what I see most of the problem is how you present your cases, what you speak, and how do you interpret your basics. That is where the exam is over. Rest of the things, cross section and all, by the time you reach your final year, you would know everything. So I think the main problem in, especially for DLB student, is not the lack of knowledge. It is the way you are presenting your cases. That is where most of the problems occur, and the only solution for that is to be there, present and attend, and actually present cases. And about how to make the most of out of them, that I have told you. And for from my side, this is the biggest advice. Don't be afraid. Just go there.
Thank you, sir. And just to repeat regarding the reading resources for those of you who have joined late, so we are compiling all the reading resources, the names of the textbooks and the websites, and all the reading resources that we have received as inputs from the residents, and we will mail them individually to each of you who is attending this session as an attendee. So don't worry about having missed the reading resources part. Okay, now the students, a couple of students have asked regarding which Telegram groups to join. So Dr. Lavanya, can you answer that? Which Telegram groups to be joined, and maybe you can,
Yeah.
post the link.
Yeah, sure. I would put that in the chat box. I think there are like a few. There's one called Radiology Vibes, and I'll go back to the Telegram groups and I'll just put that on the chat links. I think that would, they can side by side just look into it.
Yeah, thanks. So the next question is for you, sir. What are the various research opportunities, paper presentation, and publication scenarios that are available for the residents?
So there are whole lots of scenarios available to you depending upon how much time you wish to devote to them. If you want to do research, if you are working in medical government medical college, you will have plenty of material to do research. And as per new NMC guidelines, now I think at least one paper or one poster is a must. So that thing you have to do, and for that you have to attend one national conference also. And publication, most of the times these case reports and other things, and they do not get accepted, and you have to have a good original research. So choose your thesis topic wisely. That is very, very important. And if you are research oriented, if you just want to do pass out the DNB, do senior residency, and go into practice, then of course you don't need to do anything except for paper presentation, research opportunities, and publication. That we should not bother about. But if you start liking academics and if you want to become a faculty, you have to start and looking for the opportunity from day one and devote some time to that, and you will have plenty of opportunities.
Thank you, sir. Okay, so coming to the next point, what should be the competency goals at the end of the first year and the second year? That is, what are the targets that you expect from yourself, and you can assess whether you've achieved them or not at the end when you complete the first year and when you complete the second year. So I would like to put this to you, Dr. Anindita.
Hello, good evening, everybody. So yes, talking about the competency goals, well, to begin with, the moment we enter into radiology, we have already given a lot of competitive exams and we are too much oriented with our theory, and probably we are almost used to reading a lot of theory. So the problem I've seen is sometimes when you enter into the radiology department and you see your seniors reporting a lot of things, somebody would be reporting a GI case, somebody would be doing a neuro case, and sometimes we tend to feel very overwhelmed and we tend to feel that, oh my god, we need to know so many things, there are so many things that we need to study. So for first year, I think the aim should be to build your skills. Many a times that most of the students, I have recently seen some DNB students also, they tend to pay more attention to their theory rather than going and doing ultrasounds and actually going and reporting x-rays. Now the problem is, what we feel is that if we read a lot of theory, we'll mug up all the books, we'll go through RUMAC, we'll read a lot of journals and everything, but until and unless you actually put that to practice, until and unless you're doing ultrasound, it is of no use. Also remember, ultrasound is something that is kind of your bread and butter. Once you go out of your residency and you start practicing, that is not something which you realize initially. But even if you see, so to begin with, when we start doing ultrasounds, most of the times we tend to report pancreas is obscured. But as you start developing your skills, by the end of first year, you might be actually picking up malignancies in pancreas. You might be able to tell what kind of lesion it is, and you'll be able to give a better differential. Similarly, you should also remember that there are so many classifications, per se, even imaging classifications that are dedicated to ultrasound. So that is something that you should not ignore. And I'm specifically saying this because I've seen a lot of students who tend to go more into the theoretical part rather than doing ultrasounds. They feel that this is very boring, this is something over liver, spleen, GB, we can see this and okay. No, the more you do ultrasounds, you will see that you will see a difference in your reporting itself. There are so many things that will be best picked up on ultrasound only. So that is one point about ultrasound. Don't be scared. Don't feel that, oh, I'm getting bored of ultrasound. No, you will never get bored of ultrasound if you go with the aim of improving your skills. Again, with x-rays, initially you might not be able to pick anything on x-rays. Everything would be like, okay, less, no, the film is not adequate, rotation, blah blah blah, and we'll be like, oh, just leave it. But the more you tend to do x-rays, you will see that the things are coming in front of your eyes. You'll be able to do such nice reporting even on x-rays, and that will help you to even guide the physician that this is the next step that you should do. The first year, I feel you should be more focused on skill building, and along with it, when you're reporting, try to like go back and read what theory is there. Don't be too scared that you have to cover the entire thing. For example, I feel for cross-sectional imaging in most of the institutes, we are more focused on doing NCCT heads, CCT heads, or some PNS and all these cases. So sometimes even those tend to get very boring. But what we tend to report is okay, there's infarct in this lobe, that's it. What we should do is, once you start reporting, you go back to your theory, you open your Osborne, and you see that there are so many things that you can improve in your reporting. Rather than just giving a random location that there's an infarct in such a lobe, you can actually go and tell that this is probably the territory of a certain artery which is being involved. So you can improve your reporting of NCCT heads as well. So first year, any modality, don't feel that this is very boring, and don't try to jump into doing the difficult things. Like, don't try to read about HCCs or about large tumors or abdominal cases. No, whatever you're being given, just try to improve your skills on that. Now, coming to second year, when you're going into second year, that time your aim should be to do a case-based study. Now you have already known a little bit of theory, you know how to do like ultrasounds and everything. Now when you start doing a cross-sectional imaging, try to do a case-based study. And in second year, you should not be afraid to pick up cases which appear to be a little difficult. Most which I faced is head and neck cancers are something which tends to be a little scary, because it tends to spread everywhere and nobody is sure about the anatomy, about the neck spaces, and nobody really reads about them. They'll be like, okay, there's a mass, and they'll ask their seniors, they'll report whatever. So take that opportunity to actually go back and read anatomy. Only when you report a case, that only at that time you will have to look at your anatomy. You cannot just blindly go on reading about anatomy. You will never be oriented with it. So you have to take up a case which looks very difficult. That is something which even our consultants, Dr. Upreti was there, and he insisted us to like take such cases so that our anatomy becomes very clear. So second year, try to increase your skill level by doing a case-based study and improving your anatomy, so that when you're ready to go into third year, you have a good knowledge base, you have a good practical base, and then when you go into third year, you will now read more about your theory. So now you will be more into like focusing on your exams. But remember, do not forget about your practical skills. That is what I have to tell.
Thank you so much, Dr. Anindita. That was really useful. Dr. Ayush, would you like to add to this?
Hello, good evening, ma'am. Ma'am, I think for first year, Dr. Anindita has very beautifully laid a good plan for this. But I think
Can you
one
switch
thing
on
that
your
I
video,
definitely.
please, Dr.
Oh,
Ayush?
sure. I think there is one thing we can add in first year of our radiology training, and that is reading up medical physics. The radiological physics, that part we can actually cover it up in maybe first 6 months of our radiology training. So because later on when you read it up in your third year or the final year of DNB or MD, then it becomes a little difficult because you already have a lot of clinical stuff that needs to be read. So I think physics is something that we should cover in the first 3 or 4 months of our radiology training. Otherwise, rest all the things she has covered up very beautifully.
Thank you so much, Dr. Ayush and Dr. Anindita. That was really well explained. Sir, would you like to say anything on regarding the competency goals, and then we'll close this?
So I think most of it has been covered. What only thing I would suggest that pick up your study buddy right from your day one, I would advise that when you are studying, when you are revising, study in group. This group can be two or at the most three people. So what you can do is like as I said, physics in first 6 months, but it's a very boring subject. So maybe you two or three people they can decide the topic in a day or in a week, and then discuss those topic at the end of a week or whatever time is suitable to you. It is very important. When see if you look at problem, if you look at any issue, and three people are discussing that, everybody has a different take on that issue. And when you are reading, probably you will see it from your own perspective, and you will not realize that something else is also important which your colleague will pick up. So that is the advantage of discussion. When you hear things, you remember more because you have both auditory and visual input. And when you just read, you just have one input. So what I would say, reading in group, not more than three, would advance your learning, would fast track your learning, and always decide a mutual point. And I found this very good, very useful. We had a group of three people during our residency. We used to decide topic and sit on Saturday and discuss all those topics, and that really worked well for all of us.
Right. Thank you, sir. So we have a very interesting question that has been put up here in the chat box by Dr. Sandhya, that what if we get a question in the theory which we have never heard about, never read about. So there was a question that was asked in DNB Theory 4 paper very recently. It was on post-mortem imaging. So if you get something about which you have absolutely no clue and never heard, never read, then should we try to attempt it or how to handle it? Would you like to take that, Dr. Anindita?
Hello.
Yeah, Dr. Anindita.
Ma'am, can you please I just missed the question. Can you
Yeah, so the query was that at times out of the blue we get a question, something which we have never heard about, read about. Like there was a question recently in DNB theory on post-mortem imaging. So how to handle such things?
Ma'am, this is, I think every now and then we will come across such questions. Even in our theory exam, we had a question which I think nobody had a clue about. We had never heard about that. But the thing is, if we are doing radiology like for 3 years, if you are seeing cases, you will have at least some idea about the system per se. So you can at least know if you are well versed with the anatomy and physiology part of it, then probably you won't be that blank when you're answering the question. So for post-mortem imaging, so now you know what is the basic physiology that is occurring. You know that the heart is not pumping. So you know that if you're giving any contrast, probably the contrast will not be circulating. So probably it will stagnate in the heart. So that is something you can at least come up with, because that is like basic physiology. So if you have done some CT reporting, you know that the contrast will go to right side of the heart. So you can tell that the contrast will go, but since the heart is not pumping, so it will not go. So you can, I would say it is almost like a practical thing. Instead of getting very panicky, instead of just thinking that you are like a radiologist only, think of yourself as a doctor, as someone who has read physiology and anatomy also. So most of the times you will come up with something. So for in our theory question, we had a question regarding GI RADs. So that was something, a new RAD system that had come up with, and nobody had any clue about it. But again, since if you have read about other RADs like BIRADS or LIRADs or other systems, then you know that what is a basic pattern that is being followed. You at least know what are the different categories of RADs, so you can come up with some answer. You can give some answer. You would not be that clueless. So that is all I can say. That do not panic. Just take a moment, take 1 or 2 minutes, just settle down, don't be panicky, and just think that what could be the possibilities. Radiology is not like some astronomical science or something that you would not be able to make out that answer. If you think a little bit about the physiology or anatomy that might be going on, you will come up with something that wouldn't be that correct, but it wouldn't be that wrong either.
Right, absolutely. So, Dr.
Yes, ma'am.
Sandhya,
I,
yeah,
I'll,
I
I'll
just,
just add to that.
yes,
Ma'am, can I say something?
everybody wants to put in, right? I will just complete what I was saying and everybody can then pitch in. So, what I just wanted to add was that, Dr. Sandhya, the key to remember is that what you are blank in, everybody is blank in. Such a question which is unheard of for you is unheard of for everybody. And the trick is not to panic, maintain your cool, just apply your mind, and surely you will not be blank and you will come up with something. Yes, sir, Upreti sir, you wanted to say something, followed by Dr. Lavanya.
So I just wanted to say that these question, you important thing is to write something. Don't leave them blank. Never have this thing that you don't attempt them. Attempt. Write 3 lines, 4 lines, 5 lines, whatever. The reason is that these questions are later on flagged by the examiner because all of the students do poorly in these. And then if you have attempted this question, you would get, something. It may not be a passing mark in that question, but it would not be a zero which you would get if you don't attempt this. So please attempt. You will get at least 2 marks in that question because everybody is doing poorly in that question. That is all.
Yeah, Dr. Akhil has provided the information that a question also came on predatory journal. So, yes, there are out of the blue questions that you may not actually know, or some of you might know, but then, as everybody says, just don't leave it blank and try to attempt whatever comes to you. Dr.
So
Ma'am,
Lavanya?
one
can I
more,
say something?
yeah, after Lavanya, I'll also
Yeah,
add.
please.
Lavanya, please go ahead.
Uh,
That
uh,
wasn't me.
ma-
I think that's Siddhi, ma'am. Yeah, or
Okay, that
someone
was
else.
Siddhi, sorry.
Yeah.
yeah, ma'am.
uh,
I just
okay.
wanted to say that there are many questions in the question paper in DNB. Almost 15 questions are there. So whenever you find one question which is not of within your knowledge domain, just focus on the rest 14 questions because we tend to focus on one question that we don't know. So it's better that you attempt rest of the questions better. And as I said in my text messages also, you should never ever leave a question, as sir said, because you are directly telling that you want a zero for that question. You can get 1 mark at least if you write something. This predatory question that came in my DNB paper, I had no idea, but still I wrote almost 2 pages on it because based on my knowledge of predatory and my knowledge of journal, what a journal is. So these terms that you come across, nobody knows, but your result will not be based on this single question, and your result will be based on rest of the 14 questions. So that is your area of focus, not that one question that nobody knows. That's what I wanted to say.
Right, very well said, Siddhi. Thank you so much. So ultimately, I assume that what you wrote regarding the predatory journal was more or less correct, 80% correct at least.
Yes, ma'am.
Great. Okay, so anybody else would want to add anything to this point? Otherwise, we can move on.
Ma'am, I just wanted to add one thing that most of my residents and most of the first year residents that I have come across, they actually get stressed by the end of, I guess, the first 2 months of radiology residency, that they are not even learning anything. So for those residents, these competency goals are not the only goals you have to reach. Your basic goals should be that whenever you go back home that day after attending your radiology residency, that day, every day you should learn one new thing and you will be good to go by the end of the 3 years. There should not be a single day that you go home and you don't read anything new, because for a first year resident everything is new. So make a point that every day you get to know something new and you will be good to go by the end of the 3 years.
Thank you, Dr. Siddhi. So the next question I would like to put to Dr. Batul regarding how to efficiently manage your time during residency, how to maximize the output for reading, along with handling the routine everyday clinical work as well as emergency duties.
For the first 2 years, as everybody said, that you have to stick to case-based reading, which is very important. So you don't have to read everything, but all the cases which you see, like Dr. Lavanya ma'am said, that if you see some case, just go back and read thoroughly about that case particularly, from top to bottom. So after say, 2 years, you'll realize that maximum things you have already read. So just plan such way, like supposedly if you see a head and neck cancer, try to read everything in and around about that particular case. And similarly, when you come to third year, that is the time when actual time management is needed. So try to make a schedule such a way like when the exam date is announced, you have to make sure that before 3 months, you just have a basic reading of everything. So that and last 3 months, you have to dedicatedly do all the question papers. And apart from that, you have to read a few extra things also. One suggestion: just do not only stick to question paper. Once you have to read all the berries, the complete portion, completely. You don't have to just read questions and go to exam. Read berry series once, but last 3 months just stick to the main question papers, and that will help a lot. So managing time, and you do not have that special time for practical exams. So during third year, try to give at least 1 or 2 hours for your practical portion as well. Like try to discuss cases with your colleagues, or have a proper film reading session, or try to present in your department. Because after theory, you won't be having much time left, only 1 month, which is not very much sufficient. So join such programs in which you're practicing daily to speak. And I was a presenter most of the time. So sir told me one thing only: the maximum output from a session you will only get when you speak. You'll I used to make a lot of mistakes, no doubt on that. But if I was speaking continuously, that exam day I was a little bit confident that okay, I'll be able to manage this. So the main thing is third year you have to read theory, but apart from that, you have to be vigilant that you have to give practicals also. So just dedicate some time of your study time to practicals reading also, like film reading. That is important because after theory you won't have much time for that.
Right. Thank you so much, Dr. Batul. Dr. Lavanya, would you like to add to how to efficiently manage the time?
Yeah. So I think, I think she said wonderfully, like most of the things that I wanted to say. So I'll just try and summarize. We all have a very finite amount of time. Radiology is very vast. So you need to focus on things which you can retain, right? So there are four best ways to do that, to maximize your output, basically. And this has a lot to do with personality building. The first thing is find a junior and teach a junior. You will remember things, believe me, what you teach more than anything else, right? So this should be, you have to build your rapport and interaction with juniors. If you're reading something, go and find 1 or 2 juniors or even your colleagues and teach them. Get into the habit of teaching and sharing. Okay. The second thing is seniors. So you will learn so much from your seniors, your immediate seniors, your super seniors, even your consultants. Wherever you are, you will have at least 1 or 2 consultants who are knowledgeable as well as friendly. You have to build a rapport with them and get into the habit of asking questions. Do not feel hesitant. There's nothing like a dumb question. We've all been there. Even if the question gets asked back to you, you're still going to end up learning something from that interaction, right? So get into the habit of talking with people more, discussing with people more. So juniors, seniors. Third thing is cases. So like you have a 10,000 rule, 10,000 hour rule for most of the professions. To be really good at something, you need to put in 10,000 hours. So for radiology, you need to report something like 10,000 cases, which is not possible during your PG period. But the idea is the more cases you report, that better you become. So be proactive in trying to ask for cases. Go in your department. Your department is the best source for getting your cases, and report everything that you get, which is different or something which you haven't attended before. So that, and the fourth thing is, like she said, hot seats. So you have to attend more hot seats, be greedy. You have to literally make sure that your voice is heard and attend every single question that's put to you. It's okay if you fail. It's okay if you're not making sense, but you're going to learn. These are the best 4 ways that you can be very productive and useful. Yeah. That's
Thank
about
you,
it.
Dr. Lavanya. Very well described. Sir, would you like to summarize this or add something to this? Or should we move on?
I think not much to add. These people, they just pass their exam and they best know how to manage time. And
Okay.
but again, I would like to emphasize, for your examination, you need to be there in the seat and you need to be attending maximum session and you need to be presenting maximum cases. That is the only way to do well in practicals. Otherwise, during practicals, you will not have that kind of confidence. And if you do this, if you have presented 10, 20 cases, you will just sail through your practicals. Even if you're a solitary PG in a remote hospital, but if you do this on a consistent and regular basis, let me tell you, you will not fail. Nothing will happen to you. You will just sail through.
Thank you, sir. So there are a lot of questions coming in for the PD set exam, that is DNB entrance exam for the DMRD candidates, and how to prepare for them, what is the curriculum course. So let me tell you that the PD set exam for the DMRD candidates, that is a fairly easy exam and very easy to crack. And there are actually lesser DMRD candidates than, the secondary DNB seats that are available, and most of the secondary DNB seats as of now, they go vacant. So there are much lesser candidates, and the curriculum is the entire radiology curriculum. Whatever is there in your PG exit exam, it is the same, but they are just MCQs. So, 100% MCQ based exam is relatively easy as compared to the subjective, your MD or DNB exam that would have a theory and a practical. So the secondary DNB PD set exam is a simple exam, and most of you who appear for the exam will surely qualify. The next question is for you, sir. What should be the approach of a DMRD candidate, and what are the expectations of the examiners? And there was another question in the text earlier, that is the standard of questions the same for DNB and the NB diploma?
So right now, DMRD is only being done by national board, right? DMRD in university is no longer there. And see, it's a 2-year course, and as per accreditation criteria, there is no need for MRI. So see, syllabus is going to be the same. You will be shown MRI also in your examination, right? So your reading has to be almost similar, but definitely the expectations of examiner are little bit less. So even if you don't do very well, still they give you lot of leverage, and your theory questions are also easier. But yes, you have to know very good about your conventional. You have to be good. You need to know your CT well and MR as far as possible. Don't worry. This is another question which is asked to me, that after DMRD, will I get 2-year DNB? What will I do if I don't get the DNB in 2-year DNB? Let me tell you, this DNB DMRD was in fact started because there were, after the DMRD was abolished from the university, there were no secondary DNB candidates available for the DNB. So many hospital petitioned the national board because they wanted these people who are qualified. So that is why this DMRD course was started. And there are, as madam said, there are lots of seat. Entrance exam is not tough. And if you go through the DREAMS lectures, it covers almost everything. It covers almost everything that will be asked in your DMRD exit examination, as well as your PD set, the entrance test, right? So don't worry about that. Examiner knows that for DMRD, the expectation would be different from a proper 3-year DNB candidate. They give you that kind of leverage and that kind of concession.
Thank you, sir. So I am just taking the liberty to slightly change a little sequence of my question, because Dr. Ujwal has an emergency call, the interventionist among the panelists. So Dr. Ujwal, this question is for you. How much of interventional radiology do I need to know for my exit examination? Could you throw some light on this?
Can I share my screen, ma'am?
Yes, please do. So I'll stop sharing.
Yes. So my screen is visible?
Yes.
So how much topics do I need to cover? You need to cover the previous year question bank and you need to cover all the recent intervention radiology procedures for Viva. And instruments for Viva, and all long questions involving intervention like renal AML, stroke, JNA, AVM, benign prostate hyperplasia, osteoarthritis, retinoblastoma, varicose vein, etc. You need to know about the intervention getting done in these questions, because answering only the diagnostic part and not knowing about the intervention won't be like a good thing for Viva and as well as the long question. So if you are able to write about the intervention work in these topics as well as answer them in the Viva, you will get an extra edge. So I think the previous year question and everything related to the diagnostic imaging part that you are preparing, trying going through the intervention part also. That will suffice for the preparation for the theory exam as well as practical. And then what are the reading resources that is available for preparation? So for theory, you need to go through this Kandrappa Handbook of Intervention Radiology. It has every procedure explained with steps, so it will help you in writing answers. And this Bible Diagnostic Imaging Radiology will help you getting to know about every procedure. So what is the pre-procedure management? What is the imaging modalities you need to know? What is the technique of procedure? What is the post-procedure medication you need to? So it will help you write the long question. So it has an index, and whatever the questions you are coming across from the previous year question bank, you can go through this index, and it will act as like a long question for preparation. And apart from this KMCH intervention radiology platform on the YouTube channel is very good for the neuro intervention and the basics of the catheters and coils and everything. And apart from that, the online lectures like DREAMS, ICRI, and journals, whatever you are unable to find in the books or in the Kandrappa, you can go through the articles and PowerPoint presentation done in the department. So this is for the theory, and for the practical, there are various YouTube channels which covers that. This is the YouTube channel from the radiogram which is very helpful in preparing for Viva. And if you have a ISVIR membership, then you will have access to every lecture possible in the intervention radiology. So this thing, if you log into your account, you will have access to every topic possible in intervention radiology. So you can get a ISVR membership done, and it is a very free cost, I think. And what about the additional qualification that you need to have apart from MD to practice IR? So nowadays, according to the NMC guidelines, you need to have either a DM or a NMC recognized fellowship for practicing IR. So if you are very interested in IR, practicing IR, so you can give a NEET SS exam or INI SS. That is, so INI SS happens 2 times in a year and NEET SS 1 time. So recently, yesterday only NEET SS result has come. So if you are very much interested, I think you should give NEET SS or INI SS exam. And what is the entrance exam pattern that you need to go through for INSS? It is divided into neuro, cardiovascular, and intervention radiology, and the intervention radiology part. So neuro is present only in few institutes like AIMS, Chitra. So you will have questions from the Osborne only, mostly 80% questions from the Osborne and 20% general questions. And the cardiovascular and intervention radiology, you will have questions about the cardiac MRI, cardiac CT, and basic intervention radiology about the diagnostic catheters, coils, and stents. And for preparing from NEET SS, 80% question will be from the diagnostic imaging, whatever you have done in your 3 years, and only 20% questions will be from intervention radiology. So for preparing NEET SS, you can directly give after your 3 years, and if you are very much interested, you will surely get a good rank because you have already done your 3 years of diagnostic imaging. And what are the places with IR that are available? So I'll share this list with this list. Also, you can take a screenshot of this list. So how many seats are available? What is the pattern of, like, how will you get through this fellowship? How will you get into institute? So whatever is available, like a fellowship, how many years course, how many number of seats. So this is the complete list, and you can take the screenshot. I'll also share the link of this list. So these are the colleges of approximately 42 colleges and hospitals are available for practicing IR. And if you're very much interested in learning IR, I think I'm covered with all of my questions, ma'am.
Right. Thank you so much, Dr. Ujjwal. You have really provided very comprehensive information regarding interventional radiology. And
And
thank you
this is
so
the
much for your
recent
time.
that NEET SS result that has come. So I think if you have any doubt, you can anytime contact me through Dreams.
Thank you so much, Dr. Ujjwal.
Thank you, ma'am. Thank you so much.
So the second part of this question itself, that is regarding obtaining additional qualifications after doing the PG. So regarding additional qualification in intervention radiology, Dr. Ujjwal has already answered. And regarding further additional qualifications after PG, Dr. Ayush, would you like to take this up?
So I'll talk about Fellowship of Royal College of Radiologists, London. So basically, if someone is planning to go to UK or Commonwealth countries, or if you just want to, increase your level of competence and get a world-class degree, so FRCR is a good step. And the good thing is you don't need to get trained in UK. You can just pass the exam and then you become a member of the Royal College, a fellow of Royal College rather. So, ma'am, may I share my slides?
Yes, please. And we would also like you to discuss when to appear for the various parts of FRCR,
Yes, ma'am.
considering the workload that PGs have to handle during their residency.
Yes, ma'am.
And please tell about the reading resources, the exam format, whatever you have, you can tell about the
Yeah,
FRCR.
definitely, ma'am. So, as we know, FRCR exam, it is subdivided into three parts. The part one includes anatomy and physics, and then there is part 2A and 2B. Part 2A is basically multiple choice answer questions type, and part 2B is a proper practical exam, which includes rapid reporting, long cases, as well as oral viva. So I think if we plan it, I think part one is something that we can give in during our residency itself. So I think first year of residency is a good time to give part one. Uh, Maybe in first 6 months, like I told, you can read up physics. So the for physics for FRCR, the book that needs to be read is FARS Physics for Medical Imaging. So it is not a very big book, but for a starter, maybe it could be a little difficult because the topics are very concise, and and the things have not been explained in very great detail. So maybe you might need to take help from other books, but this is the book from which the questions are asked. So the pattern for physics exam is there are 40 STEM questions, and each STEM is subdivided into 5 sub questions, and the pattern is true and false. So in total, so you have a total 200 questions, basically 40 questions into 5. And so there is no negative marking in this exam. And for, I think the cutoff, it varies from session to session, but I think mostly it is around 140, 150. That is the cutoff that is there. And physics is actually a bit difficult, honestly, because it is a very boring subject. And secondly, the level of questions that they ask, it is a bit tough. So a good time would be to give this exam in the first year of your residency, and the benefit is that because of this exam you can finish up your physics part uh, for radiology. And second, anatomy part is also important, but I think the kind of work that we are doing, anatomy is not very difficult. They ask you common and very important structures that everyone needs to know. So this is the MCQ book for FRCR physics exam. This is the one which I found to be the most useful, by Dr. Varut Vardhan Bhuti. But I think there are other MCQ books also. They are also good. But this one was the one which I found was the best out of the lot. And this is the book that the Royal College recommends for studying anatomy, Weir and Abraham's Imaging Atlas of Human Anatomy. So basically for anatomy, I think for maybe in first year, maybe you might need to, brush it up, or you might need to read it thoroughly. But for someone who is in third year of PG, or maybe someone who has passed his MD or DNB exam, for those people, I think it is not an issue. Anatomy is pretty simple because by that time you are already familiar with the cross-sectional imaging. So it is not that difficult then. But for first year, this is a good starting point. In first year, if you give the part one, so your physics as well as anatomy part are actually covered. And just because you're giving the exam, so you'll read it up well, and so that part is finished. Then the second part that we come up in, that is FRCR 2A. That is a basically there are 240 questions. They give you a clinical scenario, and based on that clinical scenario, they may ask you the most probable diagnosis. So there are 5 options. You have to choose the correct answer. And usually the scenario is that there are 2 or 3 options could be correct, but there is some negative point or some point which strongly favors a particular diagnosis. So that tests your ability to, go through the differential diagnosis, how to differentiate them. The discriminating factors or the differentiating features between them, they are tested. So this is also pretty clinically oriented, and um, so for this, I think the book that I'll recommend is Crack the Core Exam. This book is for American Board of Radiology exam, but the book has very good concepts, and it is actually very good for cracking those MCQs. So this book is very good. And the time for this exam, I would suggest that you give this exam. Maybe you can plan it either in your third year of residency, or you can plan it just after your residency. Because I believe once the freshly passed MD or DNB postgraduates, they are the people who are most knowledgeable. They have read the entire syllabus a few times. They have revised it well. They have just given the exam. So they are actually the entire knowledge is very fresh for them. So either give it in the final year, maybe in the second half of your third year, or maybe you can just give after the exam. So that is the best time to give FRCR 2A. Basically, for FRCR Part 1 and 2A, there is no limitation or any minimum period of training is mandated by the Royal College. Um, uh, for FRCR 2B, a minimum 36 months of clinical training is required in a medical college. So for that, you need a certificate from your head of department that he or she has seen the syllabus for FR Royal College exam, and then the things have been covered in our curriculum and our training, and you are eligible to appear for the exam. So uh, uh, actually, you can give FRCR Part 1 and 2A at any time. It is not an issue. But for FRCR 2B, you can only give it after 36 months of your clinical training. So basically, post MD or DNB exam only you can give it. So I have seen a few people, a few of my friends that I know of, they have given FRCR 2A exam just before their MD exam, and they gave their, and few people gave that 2A exam just after their MD exam. So that is, I think, the best time to give it. And after that, so the books for this is I've already told you, the Crack the Core exam. Obviously, the main books that you are reading, they are helpful. And for FRCR exam, if you ask me a textbook, I would suggest Granger is the one because it is written by these UK people. So the protocols and things, they match with the exam. So Granger is a good book if you want to a textbook to read. Otherwise, to crack those MCQs for FRCR 2A, I think Crack the Core exam book is very good. Uh, then there are multiple MCQ books which are available, and you should actually do as many MCQs because that will actually, make your concepts clear. You'll get to know how the questions are framed, how, by changing a sentence, how, if the scenario is changed a little bit, the answer changes. So those things you will get. And I think by reading these books, I gained a lot of insight, and a lot of my fundas and a lot of my queries were solved while doing these MCQs, because they are all clinically oriented. They are not for, they are not asking any factual, facts or figures are not being asked. They are asking you some very logical and actual clinically oriented questions which have a bearing on the management of the patient. So this particular book by Oxford Specialty Training, this by Richard Lindsay and Scott Gillespie. So this one was the one which I found it was a best book out of the lot, but other books were also very good. So these are the books you can read. Then coming to FRCR 2B exam, obviously you'll give it after your MD or DNB exam. So for 2B exam, there are three parts basically. There is rapid reporting, which includes you have to report 30 X-rays. Um, you have to either write whether it is normal or abnormal, or if it is abnormal, then you have to write what is the abnormality in that case. So for that, the I think it has been mentioned previously, the chest X-ray survival guide as well as the MSK Survival Guide. The Survival Guide series is very good. I mean, that is a must-read book for this rapid reporting. Actually the reason that book is very good is that it gives a checklist of how to report a case. If you have a shoulder X-ray, for example, it will give you a checklist what all structures you are supposed to look at, what all maybe if there is say for example we are reporting an elbow X-ray, then you have to think about the anterior humeral line, the radiocapitular line, the alignment, and the fat pad elevation. So these are subtle points, and they cover basically the checklist ensures that once you start implementing that checklist, that is how you start reporting you will start picking up minute findings, small findings, you'll pick them up. So, in fact, my suggestion would be, if not just for this rapid reporting, if like everyone said earlier, that you should be focusing on X-rays and conventional imaging, and that is I think for all MDA or DNB exam, that is the first study that is put up in a long case. So, uh, reading this survival guide series is very important. I think uh, you should read it from cover to cover. It's a very simple book and very, in fact, there is not a lot of, there are a lot of illustrations and diagrams, and you'll really have fun while reading it. The main point of reading that book is you have to implement it in your clinical practice. Basically, as practicing radiologists, we are supposed to make a checklist of what all structures we are supposed to look at while reporting a case. And that should start from firstly from X-rays. So for X-rays, you'll get a checklist here. I have to look for a chest X-ray. I have to look at the lung fields. I have to look at the postrophrenic angles. I have to look at the apices, the um, behind the diaphragm, the cardiac cell. I have to look at the hyla. I have to look at the bones. So that entire checklist should be there so that you don't miss out on any abnormality, because you will realize in the practice of radiology, there are a lot of incidental findings that you will pick up if you follow a checklist approach. Otherwise, you'll always be just stuck with the clinical question that the clinician is asking, but you will never be able to give any additional information. But you'll get a lot of additional things if you follow a checklist approach. So it is a very good idea if you read the survival guide series. There are two books. One is for chest X-ray and the other one is for your musculoskeletal X-ray imaging. And they are actually essential for reporting your rapid reporting sets. If you do that, you make a, once you start following it, maybe once you start doing it, it will take some time. But once it is set in your mind, as soon as you see that X-ray, you'll see these are the 5-6 things that I have to rule out in this. These are the common pattern of fractures that I see. So you won't miss out on findings. And so that is a very good approach that you should follow in first year itself. Reading that survival guide series, because from my knowledge, at least I have not come across any other book for X-ray reporting which is as good as that book, which is so practically oriented. And there is the text is very minimal. It's mostly illustrations, and it is tried to reinforce those the main checklist points that you are supposed to look at. So for rapid
Who is
reporting, as I have
the
told you,
author
survival
of?
guide series is important. Then, sorry.
Yeah, just a moment, Dr. Ayush. I just wanted to ask that we are all aware that chest survival guide is by Felsen, correct?
No, 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 ma'am. It is
No, this is a
by
different
Dr.
series.
Yeah, it is by these UK authors. Sorry, I'll just show you. This is by the Dr. I think Lucy. It comes as survival guide. The
Okay,
Phelps.
and there are two parts. One is chest and
There are
one is
two parts.
MSK.
The one is for those musculoskeletal X-rays, and one is dedicated to chest X-ray.
Okay, okay.
So it includes everything for chest X-ray, the all signs of pneumothorax. Everything has been given very, in a very practical way, how you're supposed to approach a chest X-ray, when to suspect a particular pathology, and everything has been given very systematically. And the text is minimal. They are mostly illustrations. And what they have actually tried to do is that they have tried to you'll get an approach how to when you get an X-ray, how you are supposed to go about it, how so that you don't miss out on any pathology. So that is a very good
Right.
approach based book, and it's not very difficult. I guess anyone can finish that book in a week or two. It's not a very lengthy book, but it is very good to develop an approach for reporting X-rays. So
Right.
after that, this first part is rapid reporting. Then second part is long cases. For long cases, there is no separate preparation. In fact, I believe for Viva as well as long cases, the approach is same. And this book by Dr. Shahid Hussain, The Rapid Review of Radiology, although the images are not up to the mark, but the explanations are wonderful, and you'll get a lot of extra knowledge and differentiating points between different differential diagnosis. So uh, for Viva and long cases, basically there are 5 steps in which the Royal College expects us to write the answers, or maybe if we are in Viva, this is what they expect us to speak. So first of all, we are supposed to record our observations, what all we are seeing. Then we are supposed to write the interpretation of that observation. Then we are supposed to write the main principal diagnosis, and then any differential diagnosis, and lastly the management. They focus a lot on the management part. They expect us to write about management part. We should know a little bit about the management. What is the next step? If there is anything related to intervention radiology, that is something that we should definitely mention. And so that is those 5 points are the ones in which we are supposed to write our long cases, as well as give our answers for Viva. So this book is very good for that. Then this there are other books as well. This Final FRCR 2B Long Cases. This is a good book. Then this Aunt Penny book. This book is basically it has cases which are actually Aunt Penny. Aunt Penny are the pathognomic kind of cases in which that particular appearance is pathognomic for that particular disease. So that is something everyone should know, because if you get some such a kind of an appearance, then that is the only diagnosis that is possible, and we should be aware of that. So that is this book is also very good. Even for general reading, even if you are not giving FRCR exam, these books are actually pretty good for increasing your knowledge. They're all clinically oriented, and they are actually very good to read. This book is for top 3 differentials in radiology. Basically, when we read Chapman, so we see there are a lot of differentials for a particular sign, or for a particular pathology. But this book focuses on the top 3 differentials for that particular pathology. Top 3 means the ones which are most common in our practice. So it focuses on those, and it gives differentiating points between those 3 differential diagnoses. This book is also very good. And for this book, I found to be really helpful in the way that these 100 cases are the ones which are the most common cases which come in the FRCR exam. So these are the must know cases. So these are the cases that we should definitely know. So this book is also very good. And obviously, for reference, we should use Chapman. Otherwise, reading it from cover to cover would be a little difficult, and remembering it. But yeah, whatever case we get, we should refer it to Chapman and then see the differentials for that. And I would specially mention 2 websites for this. One is radiologymasters.com. This website is run by Dr. John Curtis, and this is a very good website. And he has given very short lectures on important, science in radiology, important differentiating points. So it is, these are small 2 to 3 minutes, or maybe maximum up to 10 minutes. There are short videos. I think there is a link to YouTube from this website. So those small videos are very helpful. They're very good science. They'll actually build a very good base for how to approach the cases in FRCR, and not just in FRCR, in daily routine practice as well. And the other website is Dr. Khan's teaching.com. So Dr. Khan, he is actually, his team is teaching like UK as well as overseas candidates. You can just register on this website. It's free of cost, and they'll mail you the teaching schedule. So they usually have once per week session of around 3 to 4 hours. So the timing is according to the UK timing. So for India, it is usually late in night. But the sessions are very good. They are very informative as well as very helpful. And the good part, it is free, so anyone can attend it. So it is not an issue. It is not a paid lecture. And even for this radiology masters, Dr. Curtis, he regularly conducts his Zoom sessions. So maybe on the website itself, you can just put in a query, and maybe he can add you in his Zoom session list, so you can get to know when his sessions are being live. And then there are other websites. I think the one which I would definitely recommend to everyone is Radiology Assistant. It is it's a wonderful resource actually. There are so many topics. You will realize the way it has been given in Radiology Assistant, it is marvelous. I mean, it, it is full of images. Uh, the matter is the text is actually very to the point and concise. It is a wonderful resource. I think for most of your queries, I think you should first look at if there is any article available on Radiology Assistant. It is such a wonderful website, for residents as well as for everyone. I mean, for radiology, it is just it gives a very good introduction as well as very good approach. It is mainly approach based. I remember during my residency time, I read a approach to brain tumors from this. It was wonderfully given. I mean, most of the things, approach to MRI elbow, approach to MRI ankle, then there's so many topics. I think over a period of time they've added a lot of topics, and I think most of the important topics in radiology will be covered in this. So it is worth giving a look. I mean, you should definitely take a look at this. I mean, this is really wonderful. Radiopedia is good, no doubt. It's just that whatever query you have for most of the topics, you will get something or the other on Radiopedia. Learning radiology again is okay, but I think Radiology Assistant is the one which is actually, it's brilliant, no doubt. It's something that everyone should actually have a look at. And then there are few resources which are free of cost available on Radiopedia for rapid reporting as well as for Vivas in FRCR 2B. So that is something we can look at. And there are a lot of paid courses for especially for FRCR 2B. So there are FRCR tutorials, revised radiology course, FRCR scholar, FRCR longs. So there are a lot of these courses. You can choose one of these and go for it. Otherwise, I think nowadays the free resources are also plenty, and they are very helpful also. So I think you can have a look at these. So this is mainly about the FRCR exam. So just to summarize, I would say for FRCR Part 1, you should try to give the exam in the first year of your residency. Physics and anatomy both can be covered, and it is a good time. Just because you're giving this exam, you'll be able to cover physics also, because it's very boring. It becomes difficult to cover it later on in your residency. Then FRCR 2A, you can give just before your final exam, or maybe just after the final exam. And for FRCR 2B, you need 36 months of clinical radiology training. So beyond that, you can give that exam as well. Try to finish all these exams within your SRship. I mean, beyond that, it becomes a little difficult, because you're not that you're more into the practice, most of the theory part you have forgotten, so it becomes a little difficult. Sometimes people sub-specialize into a particular stream, because in FRCR they will actually ask you everything. One thing I just forgot to mention, in FRCR they expect you to know a little bit about nuclear medicine as well. But whatever you need to know, that has been covered in these books, so no need to worry about that. So they expect you to know everything. Um, the aim of Royal College is basically to make a safe radiologist. They want somebody who is safe, who is reporting, and who knows when to refer a case to a subspecialist, or when to how to just pick up the emergency cases. Emergencies are the ones which are of main focus in FRCR exam, because they expect the candidate to pick it up and just tell the clinician immediately, because that is something which is very important. So that is, I think, if there are any questions about FRCR exam, please do let me know in the chat box.
Thank you so much, Dr. Ayush. That was really a very comprehensive coverage of all the information regarding the FRCR. And yes, please do put your queries in the chat box, and Dr. Ayush will answer any of the remaining queries about FRCR in the chat box. So we are almost close to 2 hours into our session. So I will now just expedite the remaining questions that we have and try to finish them off and wind up in the next 15 minutes. Okay, so there is a question for you, Siddhi. How to cope during the pre-thesis submission months, especially the 3 to 4 months that are prior to the thesis submission deadline. That is a really stressful time for the residents, and how to cope up with reading and the clinical work and the thesis, how to go about it.
Thesis is one of the most important parts of our radiology residency. So, our goal is not to focus again on the last 3 to 4 months, as I had experience with my residency. From the first day that you get the thesis topic allotted to you, you should start your thesis work. That is the main aim. So, the thesis, it mainly consists of an introduction part, and then materials and method you have already decided when the protocol was decided, and then it is just the review of literature which gets adds upon as you continue with your radiology residency. So my advice is not to focus on the last 3 to 4 months. Do not leave in for the last moment to do the printing work, because like you, everybody else is also trying to focus on those last 3 to 4 months. And inevitably, your statistics or your images or your printing work or your all the calculations, they all need to be done as in when the case is getting done. Do not wait for the last 3 to 4 months. But yes, if you have reached those last 3 to 4 months, then maybe with your clinical work which is going on, you might be stressed. But if you have done your work previously, then it helps you. You can also take help of your consultant. Basically, your consultant and your guide, who is your guide, is the most important person, because they will guide you throughout the thesis, what you have to write and how you have to write. I still remember that in my thesis, my guide, Dr. Upriti sir, he when I was panicked, he calmed me down, and he actually made me write all the important conclusive points of my thesis that were the main part of the thesis, which have to be concluded. That why was this thesis done basically. So if you do your thesis on time, basically throughout your second year residency, then the last 3 4 months will not be stressful. So your main focus should be on the results, and your collecting the last month's review of literature and then compiling the data. So do not leave anything for the last month, and please take help of your guides and your consultants. Without them, your thesis will never be complete.
Thank you, Siddhi. Sir, would you like to add anything to this?
So I think Siddhi was my PG, and I think what Siddhi says, I'll just echo that. Uh, So one important thing, as soon as your protocol is finalized, make your master sheet. Okay, make your master sheet, keep updating your master sheet with every case. Keep in constant touch with your thesis guys. At least, update the progress to the thesis guys, so that if you're not doing anything in a proper way, if you're not doing your data collection in a proper way, he will tell you how to do this. And of course, as Siddhi said, you have to write the review of literature beforehand. And last 3 months are basically for compilation of results and writing about your latest ROL and about discussion and all, where I think more than you, it is the guide who has to play the main role. And yes, at the end, the statistician they get pretty busy. So fix up your statistician beforehand. You tell them that I'll be coming to you in this time, and you have to finish my work in 1 or 2 days, because these people are very busy towards the end. So that is what I would say. So thesis is a 1 year process. It's not a 3 months process. It is 1.5 year process. Little bit each week.
Thank you, sir. Dr. Ayush, I would request you to just have a look at the chat box, and if there are any relevant questions you feel that need to be answered regarding FRCR and practicing in UK or tele-reporting for UK that you think can be answered, kindly answer them in the chat box, because we are running short of time. So I would just like to expedite with the questions. A couple of more questions for you, Preti sir. What are the other exams and qualifications that a resident can appear for in India and how to prepare for them? Preti sir, are you there?
Okay, I am muted, right? So one of them is this MICR exam, which is on the line of FRCR. Actually, it can serve as a good base point for practicing for preparing for your FRCR. So after 6 months, you are eligible for MICR Part 1. You can appear there. That has physics and anatomy, and then Part 2, Part 3, and there are, I think, Part 2 is now 1 year or 1.5 year, and Part 3 is after you finish your MD. Same in the way as FRCR. Then another exam is EDIR, which is held in India now twice a year, once in November and also in March. So that is a relatively easier examination, and that also you can appear for that. For that, you need 4 years of radiology, I think. So you need to have your PG and plus 1 more year. And for this EDIR, you don't need any specific preparation. If you're done your MD, most of you will pass, except that they ask a little bit of more of breast imaging and cardiac imaging more than what is asked in our MD and DNB examination. So just give it a little bit more attention than you give it during your MD and DNB examination. And for these preparation, I think extensively it has been dealt with by Dr. Ayush. I don't have anything more to that. I think we will be sharing the resources, and if you read from that, you would be able to crack both these exams. My very, very important recommendation and request is to give MICR in case you are interested in FRCR. That is an absolutely must. So that is a kind of, you can say, that is your sent up kind of examination for FRCR. If you pass MICR, in fact, the people who have passed MICR examination, they say it is even tougher than FRCR. And they tell me that once you pass MICR, FRCR passing becomes pretty easy. Although it is not a licensing examination, it is held in India. It is a low cost examination. So you must appear in this.
Right, sir. Thank you so much. So we still have more questions coming up regarding fellowships, the DM exam, the entrance exams. But before that, I would like to invite our course director, Dr. Amit Punkar, who will brief you about what DREAMS can offer to you for your PG learning and exit exam preparations. So over to you, Dr. Amit.
Thank you, ma'am. Thank you so much. So 3 years of residency are like really challenging. We at Dreams, we have tried to make it easier for you. So we have mainly 4 courses like resident education program, model case discussion, and mock exams. So Resident education program is our flagship program. So I have seen most of the queries in the earlier half of this session that relate to anatomy. So we have covered anatomy in detail. So we have like special sessions for anatomy and variants. And uh, there we have showed DICOM cases where you can actually relate to what are the structures and how you can see it in your day-to-day reporting. Apart from that, we have covered like physics. We have covered more than 35 topics in physics, and we are covering more. And we always welcome suggestions from students, like if they want a particular topic to be covered, so we cover that. Uh, then we had like many queries regarding IR. So we are covering IR in detail. We have covered 25 topics till now in IR, interventional radiology, and given its increasing importance, we are covering more and more topics of IR. And in next year, we'll be covering like more than 50 topics in interventional radiology. So, and with the current status, like we have like 21 modules of radiology covered. So we have included nuclear medicines also, which is a part of like DNB exams, and some many questions are asked. Dr. Ayush just emphasized that we have nuclear medicine questions in FRCR exams also. So we have started this nuclear medicine exam, and two nuclear medicine sessions. We have completed 2 sessions of nuclear medicines, and we have planned to cover the whatever is necessary in nuclear medicine for radiology residents. We have like given this thesis importance of thesis. So we have covered statistics also, and a very prominent professor from UCMS has covered it. So it will help you in thesis. Uh, so as of now, we have 21 modules and more than 400 lectures covered. So we add new topics, and we always welcome suggestions from you. So the topics, like some students ask like how long are those topics? So we have like more than 400 hours of teaching in this resident education program only. And we have covered all the modalities like USG, CT, uh, CT, MRI, and the conventional modalities like X-ray also, including the barium studies and the conventional procedures like uh, cystourethrogram. We have covered that also because it is an important part of your exam. So we are trying to cover in like coming 1 year, we are trying to cover the entire syllabus for radiology. One more important thing here in the resident education program, we have focused on basics and concepts a lot, because like if we do not cover it in our residency, it is like very difficult to cover it after our residency is over. So we have many sessions dedicated to basic concepts. So after that, we have other courses like for which are dedicated to practicals. So I have seen like couple of questions like can we prepare for the cases which are usually asked in DNB or MD examination. So we have covered those cases in model case discussion program. So we have long cases, short cases, and we have covered more than 100 cases. And actually, the faculties have explained in detail that what the examiner asks, what answer is expected from you, and if you answer in particular direction, then where your viva will go. So how should you answer that particular question? So they have explained these questions in detail regarding each and every case. And we also have an live sessions for this, in which you can interact with the examiner, the faculties, and you can yourself practice with the cases. So we generally tell students, if you prepare like one case a week, starting from like middle of your second year, then you'll have at least 70 cases till you appear for your practical exams. So you'll have almost like everything prepared before your practical exams. So apart from the cases, as Dr. Siddhi mentioned, that there are 4 stations in DNB exams. like OSCE, then IR station, then contrast and emergency, then physics and medico legal, and long and short cases. So I've like told about long and short cases. So we have covered OSCEs also. We have a dedicated sessions on interventional radiology, so which has a viva, and in which like faculties have explained in detail what all should you know regarding interventional, even if you do not have exposure. We also have like covered physics viva. So there we have shown all the instruments which are important in the DNB and MD exam and which are kept as stations. Upreti sir has taken one session on PCPNDT and all other laws which are important for radiology residents and which are definitely asked. Like one question is definitely from the medico legal side. So he has explained everything on that particular part. And we also had one session on contrasts. So we have tried to cover everything you need for your practical. So, and like one important question which is being asked like from like past 2 months about the notes, which like many students say will make your life easier. So we'll be releasing it this week. We'll start it module wise and slowly we'll cover all the topics which we have covered till now. And thank you very much for this patient listening. And your suggestions are welcome. You can WhatsApp me if you have any new topics or any new suggestion, as you always do. Thank you very much.
So, ma'am, I have to add something here.
Yes, sir.
The basic idea of dreams is to give you just one station to pass to, gain knowledge of basic concepts, to be able to do your reporting, to be able to write your theory exam, and to be able to do well in practicals as well as in your various entrance examinations. So this platform started about 2.5 years ago, and we have reached quite far. We are going to release notes. We are also going to have case discussions, reporting cases. This is the plan. And what I can assure you that I think within 2 years, this is our endeavor that probably you may not have to read the books also to do well in terms of gathering knowledge and doing well your exam. And for this, we constantly seek your feedback, as Amit said. So it is going to be a very wonderful resource. This is our mission, rather, I would say.
Yes, sir. Thank you. And thanks, Dr. Amit, for that extensive coverage, that comprehensive coverage, and all the information. There is one more question in the chat box, sir, that I would like you to take, Upreti, sir. These
Ji.
modules of 400 hours of teaching, which are accessible anytime on the website, are they enough to pass DNB without covering the weekly session?
Without covering.
The weekly session, I also did not get what this.
Okay, I think what he means that if I am not able to attend weekly, so all the lectures which are there, all the cases which are there, all the Viva session which are there, they are hosted on the website. I think Amit will confirm that. So, and they are present in the app, and you can refer to them any point. And regarding whether you will be able to do well, yes, I can absolutely assure you that you will be doing well, and within 1 or 2 years, will be covering the entire syllabus. And if you find any deficiency, you can, you know, mail us, you can write to us, you can WhatsApp me, you can WhatsApp Dr. Amit. We are here to assure that you do very well in terms of knowledge as well as in your exam.
Yes, so we put all the sessions on the website and the app next day.
Right, thank you. So we move on with our questions. The next question is for Dr. Anindita. After PG, should I think of going in for fellowship or DM?
Hello. Okay, so before jumping into the question of whether to go for fellowship versus DM, I think the first question is whether you even want to go for a fellowship or a DM. Sometimes just under peer pressure, we feel like we need to go for some subspecialty and do a fellowship or DM, but it depends on ultimately where on your demographics actually where you want to stay and what you ultimately want to do. Sometimes even general radiology people are practicing and they are doing pretty well, and depending on where you ultimately decide to settle, even that would affect whether you want to go ahead and do a fellowship or a DM, or you just want to continue doing your SRship and gain more knowledge. So that is something very important, because not everywhere in India subspecialty practice is being followed. And more than that, even if subspecialty practice is being followed, you most of the time they will want you to do other types of imaging as well. I think in southern parts, in most of the southern states, subspecialty radiology is a common thing. So if you're someone who is planning to settle there, fellowships or DM definitely a very good choice. Otherwise, you should gauge and you should decide whether you want to go ahead and not. Now coming to deciding between fellowship and DM, so not every subspecialty has DM currently. So I think DM radiology, as per as I know, is currently offered for intervention, for neuroradiology, and for cardiac imaging. That is what I know as of now. So other than that, if you have to do anything else, you'll have to go for a fellowship. Now, if you want to decide where you want to go for a fellowship and what fellowship you want to do, during your PG years, I think everybody develops a certain affinity for a certain subject. You might be liking GI radiology, you might be more inclined towards onco imaging, or you might have a vision in your mind that eventually you want to practice a certain thing. So depending upon that, you should decide what fellowship you want to go. You should not go just blind in that whatever I get, I'll just take that should not be your aim, because otherwise it wouldn't be of any help to you if you're not interested only. Then once you've decided that, I think for deciding where you want to do fellowship, what is very important I feel is the caseload. So before joining an institute, you should know that what is actually the number of cases that are coming, because unlike in MD, nobody is going to sit and teach you. Nobody is there to spoon feed you. You have to teach yourself. You'll have to learn on your own, and everything. Although these things will happen only if you have a lot of cases coming. So there might be a center who is having good faculty and everything, but the caseload is not that much. On the other hand, you might be having an institute where the caseload is so much that faculties probably do not have so much time to interact with you. In that case, I feel you should go to the institute which has more caseload, because that will help you. And coming to if the branch has both DM as well as fellowship, for example, in intervention, in that case, again, one thing, if you find, depending upon where you're finally deciding to settle down, those places you have to do a little bit of research, that at some places people prefer people who have done DM over fellowship. Some places it does not really matter whether you have done a fellowship or a DM. It all depends upon how experienced you are and how your overall CV is. So again, depending on that, you can choose between the two. Other than that, so far as I've come across people, it does not really make so much of a difference between whether you're doing a fellowship or a DM. But yes, again, depending upon where you want to settle finally, you have to like do some research with that whether they prefer DM or not.
Thank you so much, Dr. Anandita. You have really given very good tips and insights that would be really useful. So, Dr. Siddhi, I see that you have offered a lot of information in the chat box. Would you want to add anything to this?
Ma'am, I think Anandita has spoken well about this, but what I feel now is DM, most of the DM candidates, they have a good opportunity for faculty positions in medical colleges, because most of the state and the central medical colleges are coming up with their separate IR departments, and they need consultants for that. So getting a DM degree is actually a good opportunity if you want to continue in a government institute. Otherwise, for fellowships, most of the corporate hospitals, they prefer that you specialize in some form or other, because in metro cities, most of the places they tend to subspecialize. So in those cases, if you want to settle in the metro cities, subspecialization helps, and for that, if you are not interested in neuro or cardio intervention, fellowships are a good option to go with. So basically, you should find an area of interest and look for a fellowship in that particular subspecialty is what I wanted to say.
Thank you so much. And can you offer any information regarding the places where the courses are being offered, the fellowships, the DM that you have mentioned?
Yeah, so
Uh,
Siddhi has given me a list, I think. So we'll compile. Lists have come from other people also. We'll compile and send it on the mail, ma'am.
Right. So along with the reading resources, the places, Dr. Ujjwal had also given us a list of places for the IR fellowships. So along with these, we will pass on, mail these to all the attendees. Dr. Anindita, can you throw some light on this? So Dr. Lavanya, I think, Dr. Lavanya, sorry, regarding the format for the entrance examination.
Ma'am, I just wanted to speak one thing that
Yeah.
just a few years back there were very limited options for fellowship, but currently since the fellowship in under ICRI has started, a lot of places which were offering an individual fellowship have come under fellowship under ICRI. So that is a very good opportunity for those people who are seeking fellowships. And the entire detail is available on the ICRI website. So that is a good opportunity for fellowships currently.
So just taking ahead what Siddhi said. So we have right now 65 subspecialty seats in the ICRI umbrella, and they are likely to be increased this year. And the format for examination is a MCQ type of examination. We have about 100 questions to be done in 120 minutes, and there is single best answer out of 4 or 5 options, and there is no negative marking. This is about the fellowship of ICRI. And about others, wherever the fellowships are there, mostly the entrance examination is broad based. That is, it is like your MD and DNB syllabus, and some places post written examination they have interview also, where you would be asked some question related to the subspecialty you want to join. I hope I am right, Siddhi, on this.
Yes. One more thing, some of the institutes where fellowships are there, so whatever specialty that you're opting for, they also have list like some places are 50-50, that 50 will be general radiology and 50 will be subspecialty. So this varies, and you have to actually check for the institute that you're applying for, that what are the guidelines, because they are different for all institutes. And that is why fellowship under ICRI is advantageous, because you have a similar format and all the institutes are following that same format. So fellowship under ICRI is, I think, the most upcoming thing that one should go for.
Thank you. Thank you so much. And to answer your question, Dr. Alpesh, these days you can get the IRIA membership online through the IRIA website. And when you go to the website, you can see there become a member or membership. And when you open that, you can fill the online form. You need, if you are a PG, you need to get a specific document from your HOD certifying that you are a PG resident, because you will not be able to provide a degree while you are a PG. So you need that certificate of being a PG, which is signed by your HOD with the stamp on the letterhead of the institute. And other than that, you just need to upload a soft copy of your MBBS and your the state medical council registration, whichever state you are in, and you apply the you fill the fee online, and you need one proposer and one seconder for your membership who are already IRIA members, your seniors, the senior residents, faculty, any of your friends, senior colleagues who are already members. It's really simple. That's how you can get the membership online through the website. Okay, then coming to the last question for today. Uh, okay,
I
we
think
have a
this is
couple
already
more.
covered. I think.
The job prospects improve if I do a DM or fellowship. And if I am not interested in either, I want to go into practice, then should I consider doing a job or setting up my own practice, my own center? So, Preeti sir?
Okay, if you want to go into practice straight away after you're doing your PG, I would not advise that. First thing is you need to have some kind of independent experience where you do the first hand reporting, and you are responsible for reporting legally also. Like in your PG, you do report, but mostly you are supervised by either a senior resident or a consultant. And you when you know that somebody is above you who is going to check you, this is a kind of subconscious thing that probably you will not be so much this thing. But when you are alone there, uh, legally responsible for your work, then you will be more attentive, you would read more, you would do a better reporting. So I would advise doing at least 6 months of senior residency. That is minimum. And if you want to open your center, it is always better. Practice private practice is an absolutely different ball game from what you have in your PG and senior residency. So do a job for at least 3 to 6 months, and maybe then go for your own practice. So do at least 6 months of senior residency, number one, and before opening your center, do at least 3 to 6 months of a job.
Thank you, sir. So I think most of the questions have been answered, and I think most of the points and issues have at least been touched upon, some of them explained in a great detail. And we are close to 2.5 hours into the session. So I think, should we close the session now, sir? Or
Yes, yes, we will close, and unless there are a few more questions, and I'll Dr. Amit will share my number. So in case you have any query regarding DREAMS program, you can contact Amit, you can contact me. And if you have any other question related to radiology, your career, your life, anything, you can contact me.
so we'll close the session. If there is something really important that you feel has not been touched upon, has not been explained or taken up, and has been totally neglected, or we just missed some important point, then you can put it in the chat box. We'll take it up. And otherwise, we would, just go on and close this session. I take this opportunity to thank each one of you, all the panelists who have taken out their valuable time, given us so many useful inputs, and they are here till well past 11. Dr. Siddhi, Dr. Ayush, Dr. Anindita, Dr. Tulika, Dr. Batul, and Dr. Ujwal, who has left for now, Dr. Lavanya. I think she got disconnected in the middle. So all of you have really given us very important, valuable insights and points and tips for the residents. We are all grateful to you. Thank you so much.
Thank you, ma'am. Thank you, sir.
Thank you,
Everybody
ma'am.
have a best of luck
Thank
for
you
your
so
Thank you,
much,
future.
ma'am,
everyone.
for the opportunity.
Thank you, ma'am.
Thanks a lot. So
So,
we'll
Dr.
close.
Amit, you will be hosting this on the website as well as on the app, as some students have demanded.
Right, sir.
Yes,
We
sir.
should do that. Yes,
Okay.
that would be nice. And I'll repeat once again that all the reading resources we will mail to you, as well as the list of the various places where the fellowships and the DMs, the further courses are available. That will also be mailed to all the attendees. So we'll sign off for now. Thanks a lot. Good night. Bye-bye.